Welcome to the Profit Trap Podcast, Health Insurance Industry Secrets, for anyone who will ever own or use health insurance in their lifetime. Health Insurance Information Alert, MACRA, Medicare Access and Chip Reauthorization Act, 2020 Medicare Health Coverage, Terminations. What is MACRA? Medicare Access and Chip Reauthorization Act of 2015. MACRA has several components going into place coming day 1 of 2020, one of which is new limits on first dollar coverage in certain Medicare supplement insurance plans for individuals considered newly eligible. Anyone who is turning 65 on or after January 1st, 2020 is defined as newly eligible, or anyone who is eligible for Medicare benefits due to age to disability as defined by CMS Medicare. Elimination of Medicare Supplements Plan F and C on January 1st, 2020. Anyone who turns 65 on or after January 1st, 2020 will not be able to purchase Medicare Supplements Plan F and C. If you have a Plan F, do you keep it? Why are these changes happening? Plan F is the guaranteed issue plan being terminated. Carriers are covering higher Part B deductibles from $147 to $183, $36 increase, almost a 25% increase in just a few years, costing millions more to offer Plan F in the market. The possibility exists that those that remain on Plan F may have premium cost adjustments in order for the carrier to maintain offering the plan. Some situations allow people to join Plan F without medically qualifying prior to 2020. No one that turns 65 after January 1st, 2020 will be able to purchase a Plan F or C. Now let's compare the facts and statistics for consideration of a plan. Plan F costs an estimated $700 more than Plan G per year based on carrier averages. Go ahead and pay a Part B deductible of $183 currently and save an average of $700 in savings a year on average with the same coverage other than paying your Part B deductible. Plan G can provide matching benefits with a history of more stable rate structures. Guaranteed issue rights, also called Medigap protections, are rights you have in certain situations when insurance companies must offer you certain Medigap policies. In these situations, an insurance company must sell you a Medigap policy. They must cover all your pre-existing health conditions, and they can't charge you more for a Medigap policy because of past or present health problems. In most cases, you have a guaranteed issue right when you have other health coverage that changes in some way, like when you lose the other healthcare coverage. In other cases, you have what's called a trial right to try a Medicare Advantage Plan C, Part C, and still buy a Medicare policy if you change your mind. When this happens to you, you can choose the guaranteed issue right that gives you the best healthcare choice. Can you buy a Medigap policy if you lose your healthcare coverage? You may have a guaranteed issue right to buy a Medigap policy. Make sure you keep these items: a copy of any letters, notices, emails, and or claims denials that have your name on them as proof of your coverage being terminated. Also, the postmarked envelope these papers came in as proof of when it was mailed. You may need to send a copy of some or all of these papers with your new Medigap application to prove you have a guaranteed issue right for new coverage. You will need to apply and complete the enrollment process for a new Medigap policy before your coverage ends on your current plan. The Medigap insurer can sell it to you as long as you're leaving the plan. Ask the new policy to take effect no later than when your current coverage ends, so you'll have continuous healthcare coverage. Here's some helpful hints about your Medicare plan decisions for now and in 2020. You're allowed to shop for Medicare supplement plans all year long. Unless you are in a guaranteed or special enrollment period or enrolling in a guaranteed issue plan, you must always qualify medically to enroll in a Medicare supplement plan. Monthly premium rates are based on your zip code, age, and gender. If your doctor accepts Medicare, they will accept all Medicare supplement plans. If you have had the same Medicare supplement plan for more than 2 years, you could be overpaying for coverage and need to look at other additional options. coming March 31st, 2019. Like us, follow us, share us, subscribe to us, and download us. The Profit Trap Podcast, Health Insurance Industry Secrets. You can find us on YouTube, Facebook, Instagram, Twitter, our podcast, and the website. Depending on the media venue you are viewing right now, you may find the links below. Get connected today so you don't miss out on any of this must-have, need-to-know information to protect yourself, your family, your assets, and your future.